These peritubular capillaries then reunite to become the cortical radiate veins, then the arcuate veins, then interlobular veins, and finally into the left and right renal veins, which connect to the inferior vena cava. The flow of the veins are similar to the arteries, but in reverse. There's a segmental artery but no segmental vein. Within each kidney, there are about 1 million nephrons, and each nephron is made up of a renal corpuscle and the renal tubule. The renal corpuscle is where the blood filtration starts, and it includes the glomerulus, the tiny bed of capillaries, and the Bowman's capsule, which is made of renal cells that surround the glomerulus. As blood flows into the glomerulus, water and some solutes in the blood like sodium are able to pass through the endothelial lining of the capillary, move across the basement membrane through the epithelial lining of the nephron, and finally into the Bowman's space of the nephron itself, at which point it is called a filtrate. The epithelium of the nephron is made of specialized cells called podocytes, which wrap basement membrane like the tentacle of an octopus. Between these tentacle-like protections are tiny glass called filtration slits that act like a sieve, allowing only small particles such as water, glucose, and ionic salts to pass through the white blood protein and red blood cells. As the filtrate leaves the Bowman's capsule, it flows into the renal tubule, which is surrounded by the peritubular capillaries. Now, before we divide to find in here, let's redraw the nephron so that the structure of the renal tubule is a little more accurate. Alright, so the renal tubule itself can be divided into the proximal convoluted tubule, the nephron lobe, also known as the lobe of Henle, which made up of the blood which ultimately sent during the minor calyces. Here, the filtrate becomes fine and based on what the body wants to. It wants to discard with water and solute, getting based back and forth between the filtrate in the lumen of the renal tubule and the blood of the peritubular capillaries. Each nephron also has a really unique region called the glomerular complex, which is involved 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 in the regulation of the blood pressure and the glomerular filtration rate, amount of the blood that passes through the glomeruli each minute. The glomerular complex is located in between the distal convoluted tibial and the afferent arterial. There are three types of cells in the glomerular complex: macular denser cells, glomerular cells, and extraglomerular mesangial cells. Macular denser cells are located in the distal convoluted tibial, and their levels of sodium and chloride are low. So, in the case of hypovolemia and hypotension, the macular denser cells sense the low sodium and chloride levels and send the signal over to the glomerulus. In the world of the afferent arterial, the extraglomerular mesangial cells help with the signaling between macular denser cells and glomerular cells. The glomerular cells then receive the signal and also independently sense the low pressure in the blood vessels and secrete an enzyme called renin, which increases sodium reabsorption, which helps rise the blood volume. Renin also causes constriction of the blood vessels, which helps rise blood pressure. Once millions of nephrons have it met urine, it flows into the renal calyces, then calyces, and finally into the renal pelvis. From there, it goes down the ureter, which has muscle lining, which helps push urine along.